The contraceptive method I will be teaching about is Implanon. Implanon is a form of birth control that is used by women to prevent pregnancy, and it does not protect against STIs. It is a hormone-releasing, flexible-like stick that is 4 centimeters in length and is inserted by a healthcare provider into the inner side and upper part of the arm. Having Implanon put in is considered a minor surgical procedure, which is done in the doctor's office, and it is inserted using a needle. Before having it put in, the doctor will usually plan it around a specific time of the menstrual cycle and will have a pregnancy test done to make sure you are not pregnant. This method works by releasing the progestin hormone etonogestrel. It prevents pregnancy by stopping the release of the egg from the ovary, and it also affects the cervix by changing the mucus so that it's harder for the sperm to get to the egg, and it also changes the lining of the uterus. It can be used for up to 3 years, and then the old Implanon will need to be removed, and a new one can be inserted. But Implanon can be removed before the 3 years if the need be. After it is inserted, the healthcare provider will feel the arm to make sure it is in place. The typical failure rate for Implanon is 0.05%, and the perfect use failure rate is also 0.05%. One advantage to Implanon is that its failure rate is so low and that it is effective for 3 years, if you choose to have it in place for the full 3 years. This is beneficial because there is no need to remember to take a pill every day or to go in and get a hormonal shot. The disadvantage is the cost. This minor procedure can cost anywhere from $400 to $800 or $11 to $22 a month over the 3-year period. This is one of the most expensive forms of birth control, but it also has one of the lowest failure rates. If my friend were using Implanon, I would tell my friend that is an effective way to prevent pregnancy, but not to prevent STIs, so they should use a barrier contraceptive.